Oh, well,
Excellent.
aloha, everybody. Aloha. It's so nice to be connected. And even though that is virtually, we are so excited to have this event. The Hawaiian Spa Association Board worked very hard on getting all of us connected. And I want to welcome you, and very, very excited that during these tough times, we are still are together and trying, of course, create that community of spa, wellness, love, healing. And so I just want to welcome everybody and invite you to come and visit our Hawaiian Spa Association. And so please make sure that you always put HawaiiSpaAssociation.com. In the past couple of weeks, we had a little bit of challenge with our website, but I think right now is working extremely well with a lot of great information. And talking about that, I wanted to pass the baton to our Director of Education, Mr. Sean Hallam. And Sean, if you don't want, do you mind grabbing it?
I will grab it. Aloha, everyone. And thank you so much, Cecilia, for your leadership through this interesting time. I'm sure everyone, if you're like me and everyone else on this call, you are having a lot of questions about, how we're all going to get back to work and what will spa look and feel like when we do return. And so I'm really excited to tell you that we've been collaborating very actively as your board to bring you the latest information, tools, and resources, which we're going to talk about today. But one of the most exciting things we've been working on is inviting guests and members of Hawaii Spa Association to share information with our community to help us all understand not only what is happening now, but what are the plans as we all consider getting back to work. And so before I go any further, I do want to introduce somebody that everyone knows already, but certainly someone who has really held our Hawaii Spa Association near and dear to her heart for many, many years, and has rejoined the team to support us through this incredible transition in time, Sharon. So let me just pass it over to Sharon, if you could just introduce yourself to the group.
Aloha, everyone. Great to see you again and giving you all virtual hugs. Sharon Osaguro. I currently now am based in the desert, as you can see behind me, but have recently worked in Lanai on a project in Hawaii and just love being part of the Ohana. So I'm so humbled and honored to be able to support Daryl and Cecilia and Jennifer and you, Sean, in all the things that you've been doing, and so glad to reconnect with all of you. Aloha.
Thank you so much. Well, what we're going to kick off today is, of course, we have some exciting information to share about our website. We do have a new URL, as Cecilia mentioned, and we'll walk you through that at the end and some exciting resources. But really the essence of what we're doing now is a series, an educational series for all of our members called Navigating Together Post-Pandemic. And the platform of these sessions, which will occur every week, today being the first session, is inviting some experts, not only in the industry of spa and in wellness, but also in the larger community of health and well-being. Also our hospitality partners out there, everyone's sort of navigating together to get through this. So today we're going to share with you, and I'm going to kick it off in just a moment, our very first guest. This interview was really profound for me to do, and I think we learned a lot. But what you're going to find in this interview and in future interviews is that we've identified the top 5 questions that we think all of our Hawaii Spa Association members are going to want to know from the people we're interviewing. And so after the interview today, when we kick it over to some other board members to chat with you, we'll help you understand how to get us information to enhance future interviews. But I'm going to cue the first one, if everybody's open to that. Ready to roll?
Yes.
Okay. And I do want to say the first interview that I'm going to share with you today was a recorded interview, excuse me, a recorded interview. Our typically we do strive to have guests live with us during every session, but our first guest is a physician, and as you can imagine, our physicians are very busy at the moment. So we were able to get our first guest to record the interview that he did with me just yesterday, and I'm going to play that for you now. Aloha, it's Sean Hallam, the Director of Education with the Hawaii Spa Association, and I'm very excited to have an important guest with us today, Dr. Michael Jackowitz, joining us from Maui. Dr. Jackowitz works with Minit Medical. I thought I'd take just a moment to give you a little bit about Dr. J's background. We like to call him Dr. J. He has his undergraduate degree from Emory University from Atlanta, Georgia, medical degree with Nova University in Miami, and he did his residency with Beth Israel Medical Center in New York. Just some other fun facts about Dr. J is that he was also the house doctor for the New York City Ballet and for the New York City Opera. So we don't meet many like you here on Maui, Dr. J. I'm so glad that you could join us. Thanks for taking the time to do that. How are you doing today?
Happy to be here.
Excellent. So you work with Minit Medical here on Maui, and I know that Minit Medical has 3 locations around the island, and you know, as a local, we're also very fortunate to have quality medical services here. And I think you're a very timely guest because a lot of us with the Hawaii Spa Association are just itching to know what's happening in the medical community and what's happening on Maui right now and throughout the islands. So I thought it might be a really good thing for us to start with our burning question. We'd like to have an update on the state of health and well-being here in Hawaii. Can you tell us a little bit more about that?
Sure. So first disclaimer is there's some dogs running around. If we hear some barking, just, sorry about that. So every Tuesday morning, members of the healthcare community have a call with Josh Green, the Lieutenant Governor, and we get updated on trends and statistics and things that we're looking for in the future. And so yesterday we had a call, and I'll just share some of the stuff we discussed. Right now in the state of Hawaii, as of yesterday, there were 621 new cases. I think there was 1 case reported today thus far, which is very low. 116 of them were on Maui. We have done 33,500 plus testing since the pandemic began, with about 1.8% positivity rate, which is extremely low. And even better, the recovery rate is very high, approaching 90%. And that just means that of the people, I think 544 of the 620 cases have recovered. So that's almost approaching 90% recovery rate, which is great. And what that demonstrates is that we as a community here in Hawaii have really, you've heard the term flatten the curve, but what does that really mean? It means we never had a surge. Like if you look at the data that was predicted, we were going to see all these deaths and we were going to see all this activity, but our ventilator use right now is 14%, that's it. And we have plenty of ICU beds and hospital beds. So we really never had that surge because of the social distancing and because of the aggressive protocols that were put in place by the state government. So, I think that's very good and very exciting. So one of the things that we're talking about is how do we safely open the world again? And I'm sure that's what's on everybody's mind. And one of the things that we talked about was May being focused on Kama'aina domestic, economy. So it's things like the florists and the car washes and things that are really easy, low risk businesses. And then into June, start with the medium risk, like restaurants and things like that, more retail oriented things. And assuming those do well, and everybody continues with social distancing and we reopen, because we've had such a low number of cases in general, we haven't had the tourists back yet, we should be okay to open the economy. It's a thoughtful way. It's kind of like Cuomo in New York. He's very thoughtful, he's methodical, he does things on a scientific basis, not just a free-for-all, let's just open the world. So one of the challenges that we're going to have that we all must face is how do we bring tourists back to Maui? And so what's being discussed is right now, Australia and New Zealand also have very similar statistics as Hawaii. And so they don't have a big thriving metropolis like New York City or Chicago where you've got
Nothing to go live.
and so they've also been able to maintain the outbreak. And so right now there's what they call a travel bubble between Australia and Hawaii. I'm sorry, between Australia and New Zealand, and they can freely go back and forth. What we are trying to look at is extending that, making it a triangle, like the Polynesian Triangle, to include Hawaii, which would be great because there's 30 million people there that could be traveling, and it would be a good way to introduce travel back to Hawaii. And the challenge with the mainland, of course, is that they are making bad decisions right now, and the states are all over the place, and we will see in 4 weeks the repercussions of reopening haphazardly and doing what they're doing. The expectations will have about 200,000 unnecessary deaths because of reopening prematurely. And so what we have to do is do some kind of a testing protocol. You can't make somebody do it, but what you can do is say, okay, from the mainland, if you want to come to Hawaii, welcome. You have a 14-day quarantine period unless you do the following. Within 72 hours of arrival, you need a negative test, right? And it doesn't really matter, frankly, what test it is. There's the nasopharyngeal swabs, which if any of you have had, are torture. I mean, it feels like you're getting a lobotomy. It's very uncomfortable, but that is the best way to diagnose active disease. And then there's the new antibody testing that's starting to be rolled out as we speak. The issue with the antibody testing is right now they only have IgG available. And so just a quick immunology lesson. Within about 10 to 14 days after an infection, after exposure to a virus, your body will start to make antibodies. And the first antibodies that it makes will be IgM. And then it will start to develop IgG. So IgM represents acute infection. IgG represents either chronic infection or immunity or some kind of exposure that you've had to the virus. So we don't really quite know what to make of the antibody testing yet. I can't look at somebody's IgG level and say to them, oh, based on this, you have immunity. We just don't know that yet. But as we start to learn that, then antibody testing will factor in here. But really, whether it's the saliva tests that are coming down the pike, or the nasopharyngeal test, or the antibody test, any test, frankly, will knock out a lot of people. Because if you have the number is about 30,000 a day tourists coming to Hawaii. So last year, in June of 2019, there was almost 1 million people arriving in the month of June. Well, 1% of those are positive. I mean, you do the math, right? It will take, within 10 weeks, our ICUs will be completely overrun and we'll have no ventilators and it will be a mess. So we have to do this correctly and we have to do this smartly, and therefore, we will give people an opportunity to bypass the 14-day quarantine if you do whatever protocol they ultimately, call for. And my office is working on some of those protocols to implement stuff and do telemedicine conferences if you have to, but that's kind of what we're looking at. So hopefully, like we started to say, May would be the local low risk, June would be moderate risk, and then July-ish, we could start looking at international tourists and then the mainland, if in fact all this goes well and we don't have a surge based on stupidity of people and not following the rules. So that's kind of an overview, I think, of the state of the affairs. Pfizer is working on a vaccine, and they are apparently in advanced trials. They started to do human trials already, which is exciting. The expectation is right before the election, they'll probably announce that this is happening. Whatever. So that's an overview of kind of where we are, I think, at the moment.
Well, thank you for framing that. It's very helpful. I mean, to really understand the global state of affairs and really making it very micro here in Hawaii. So what I'm hearing you say, Dr. J, is that here in Hawaii, we've got a plan. We're managing it very well, relatively speaking, to other markets. So we will begin to have businesses open based on their level of risk, the low risk businesses first, and reviewing that, ensuring it's all going well, and eventually we'll all be back to work. But we want to watch it very carefully. And because we've done such a good job, we have seen, again, relatively speaking, lower levels of COVID here in Hawaii, and we can manage our resources.
Yes, and the expectation is that because we've done such a good job and because we have such a low mortality, when people are able to travel, Hawaii is expected to be a very popular destination. And they expect in the fall and all of 21, like that's where people are going to want to travel, because we have a protocol in place to keep the disease out. And it's kind of like what we did with rabies, right? We've controlled rabies. There's no rabies on the island. And in order to get your dogs onto, soil here, it's a very, arduous process that you've got to go through. And we'll do something similar with tourists to make sure that, when they're here, they're not looked at like the pariah. They're not looked like they're horrible people, because it will have cleared our process, in which case we can love them and not think of them as an incubus of viral plague.
Okay, good. So, I think that the silver lining here is that we are a desirable destination, and because we've done such a great job, knock on wood, I'm looking for it here, we should come back very, very strong, provided we continue to do what we're doing, managing it really well. Awesome, thank you. Well, I've got 5 questions for you, because here at the Hawaii Spa Association, we've got a platform of what we believe to be the top 5 questions that our industry professionals, our members, are going to want to know about the community and about the people we work with, and now you're included in that. So my first question, Dr. J, is how will the new normal affect the way that you do business at Minit Medical?
So what became very clear early on is telemedicine is the wave of the future. And from the very first weeks of the outbreak, frankly, we implemented a process where if you have a fever and respiratory symptoms, you are not allowed in the clinics. So there's a big thing that stop, do not enter, and here, go to the website, and where you are directed to a telemedicine conference where you talk, very similar to the way we're doing right now. You talk with the provider, and the doctor will talk you through and determine if you meet testing criteria. And if so, we have one of our offices that's manned up to have all the PPE, and we send them over, and you never leave your car, and you just get your swab and you get the results. And we really drop the risk of spread in that way. And what I've come to realize is that telemedicine is here to stay, and it's the wave of the future. People love it. It's really easy, and we resisted in medicine for a long time, because somebody has an earache, it's tough to do that exam without looking at somebody's ear. Somebody has a UTI, it's hard to do that without the urinalysis. But nowadays, with symptoms and with a good history, and even a physical exam, I can tell looking at somebody on the thing. Obviously, I can't look at their tympanic membrane, but I can really get a sense of how sick they are from looking at them on a platform like this. And so I think that is for sure the new normal.
Okay, wow. So technology is going to be even more important in the medical arena. It's so funny you say that, Dr. J, because I will tell you that a lot of spas have been considering how we will leverage technology in our business, not only post-COVID, in terms of making things as minimizing the contact between us and our guests and allowing them to participate in experiences that are self-driven or self-initiated. But we've been talking about this for a very long time. How can we use technology to get people into the space of relaxation and to get their needs met, and to really use that to our advantage? So sounds like we have to face it now more than ever, because people need to feel in control. My next question is, what advice do you have for our members at the Hawaii Spa Association, all of our spas here in Hawaii, as we plan to reopen our businesses?
Right. So I feel that every industry is going to have a slightly different, set of instructions, if you will. There's some basic stuff that everybody should be doing, but but you're particularly challenged because of the proximity that you're dealing with clients and guests. So I think what's important to understand is how the virus is transmitted and the difference between contact, droplet, and airborne precautions. So, and I'm sure many of you may know this, but I think it's good just to refresh. If you have influenza is a good example, and COVID is a good example. These are droplet precautions. And what that means is when you have the infection and you sneeze or cough, the particles come out in these secretions, but they're heavy. So they come out and you cough, they come out and they fall to the ground or whatever surface you have in front of you. And they don't disperse throughout the air. So if you're within 2 feet of somebody coughing and you don't have a mask on, then you can be exposed, right? As opposed to like tuberculosis. Tuberculosis is airborne precautions, meaning you cough, the particles are tiny and they disperse throughout the room and they go in all corners of the room. So you could be 20 feet away from me and at risk. You can open a door and that hallway is now at risk. I mean, it's kind of like the angel of death from the 10 Commandments. I mean, it's going wherever you are. And so but COVID is not that, right? But there's one exception that really will matter to spa folks, I think, because when you aerosolize the particles, that causes the little particles to become airborne. And so if you're in an ER and there's a patient with asthma has a nebulizer treatment and they're inhaling that, well, that nebulizer aerosolizes the particles. So that's a big problem, right? Mm-hmm. Other things to know, this isn't, if you have an active infection, you can shed virus in the feces. And when you flush the toilet, that's an aerosolizing event. So that's how we can pass the virus. If you're in the bathroom on your phone, then you walk outside, that phone is infected, right? And then you put that down and somebody else picks that up. That is how the virus can be spread. It's not spread skin to skin, right? It's not a skin to skin issue, but if I sneeze or cough into my hand and I pick up the phone, even if I'm wearing a glove, if I pick up the phone or I open a door handle, that object has now become contaminated. And so it's really important to understand how masks are useful. So Sean, there's a diagram I sent you. Could you pull that up for folks so we can, while I'm talking about this? So if you're wearing a mask and the other person is wearing a mask, it's a very, very low risk. And let's go to if you go to the top, you see there's 2 people. The one on the left obviously is infected and the one on the right is not. Neither are wearing masks and they're both in proximity to each other. The risk of catching is very high. Now we've put a mask on the other person, and now it's if somebody's coughing in your face, it's still high, but you can see if you put an infected person, if you put a mask on them, then it drops to medium, and if you're both wearing a mask, it's low, and if you're 6 feet apart, it's very low, and if you're at home, it's none. Right, that is why we went into shelter in place, right? Because we wanted to really prevent that from happening. But I think when you look at like, what kind of mask do I need? A cloth mask, a surgical mask? They all do the same thing in this context. You are not a healthcare provider worrying about being in a room with a COVID patient 24/7. So you don't need the N95s. You just need a mask to keep you separate, to keep the probability of contagion low.
Okay.
So that is one. And the other thing I want to just say is one size doesn't fit all for re-entry, right? Everybody has to use the recommendations by your board, and as they get disseminated, every industry will have different recommendations. And if you're 70 years old with hypertension, diabetes, and a history of heart disease or lung disease or asthma, you're different. We have to think of you differently than we do the 30-year-old that's healthy, because they're going to have very different outcomes, or they potentially could have different outcomes if they get infected.
Wow. So what I'm hearing you say is that it's one size doesn't fit all. and that there are maybe some unique risks associated with our way of doing business in spas. I mean, what I was hearing you say when you were describing about aerosolizing events and things like that, you know, we use things like steamers and misters and all sorts of things, aromatherapy. And while I haven't yet seen any conclusive research on those things, we should be considering how the likelihood of their ability to increase risk. I mean, I personally am now thinking a lot about steamers and the fact that I don't think we're going to be using those in our facial services for the time being. Would you agree with that?
That's right. I feel like if you have an aromatherapy situation across the room, that's low risk. But if anything's being sprayed and somebody coughs, or you have like a steamer that can aerosolize particles, and for the current situation, I think that's a no-no.
So lots of considerations, and you also said that we really should be looking to our massage therapy boards and our cosmetology boards to be the driving force to create the new rules, the new normal, enhancing what we already know. I mean, I think we do a great job in general with sanitization and hygiene and everything else that is mandated by our licensures, but it's going to change, right? There's going to be more because this is a new world. All right, so next question for you, Dr. J, is, you know, we're famous for our aloha spirit in Hawaii. How can we maintain our aloha spirit now?
Right. So to me, aloha spirit is not about hugging and kissing and touching and feeling, right? To me, aloha spirit, and this is what I do with patients all the time. My job is to connect with somebody, right? Connect with them and make them feel special. And if you make somebody feel special, they are going to appreciate it. And that to me is the aloha spirit. And it doesn't matter how you do that, but there's lots of ways to do that. But that, to me, that's the key. Making somebody feel important and special is the key to keeping the aloha spirit alive and well during COVID.
Yeah, so it's really the feeling that you can create that has nothing to do with the ceremony or the gesture. It's
Right.
about the feeling. Relationships will be more important than ever.
And I think for lays, we can start a new tradition of having a ring toss. So we just throw them.
I think that's awesome. My brain is turning about how many points you can earn for that, and if you get free spa services on your 5th try, or what happens. Okay, next question. What's the biggest lesson that you've learned personally during your downtime? Or I won't say downtime for you, but during the time that we've all spent the last couple of months reassessing and staying at home?
Well, I saw a wonderful video, which I'll share with you later, but it's really like the state of the world, right? We were very much, planet Earth, right, was very much in this mode. And Mother Nature just said, hey, you know, time out, we need to reboot. We need to reboot the planet. And this, you know, I am connecting with people that I haven't talked to on Zoom and on Skype and in years. And so I'm really connecting with people again in a way that I haven't done in a very long time. And I feel like that's the lesson, right? Like, how do we connect as a community, as people, stay in touch with our friends and our loved ones, and you know, get our head out of that, that phone situation where you're just never present. And being present, I think, is the take home.
Wow. So being present and reconnecting and not taking for granted those relationships that I think we all knew were there, but maybe we haven't nurtured as much as we could have in a while. So that's very profound. Well, I have a finale question for you, and it's personal, if you're okay with that. You okay with that?
Sure.
All right. So what have you personally done to stay mentally, emotionally, and physically well during this time?
Well, I mean, first of all, I see a lot of people complaining about the boredom, and I crave a little boredom. When I'm not in the clinic, I'm working on protocols to help, reintroduce the world, certainly in Hawaii, back to business and get the economy open, and working on various levels. Plus, as you alluded to in your intro, I'm a producer, so I produce on Broadway, and I've worked with Lincoln Center and the New York City Ballet and New York City Opera, and I have four projects that I'm producing. So between my world of medicine and trying to maintain my production company, I crave a little downtime. I really need a massage. I need a spa day. So we got to get on that.
Yeah, we're ready for you, Dr. J. I know that we're so grateful to you and to the entire medical community, all of our first responders, and there's so many, not just in medicine, but the people working in grocery stores, the people working at the gas stations, people keeping us moving with our essential services during this time, and we're very blessed to have you. Thank you so much for sharing your time with us, and I promise I'll show our members your video.
Okay, good. So I just leave?
You can just leave. Thanks for coming.
Bye.
Aloha.
Bye.
Okay, well, that was an incredible opportunity to connect with somebody really important here in Hawaii to keep us all healthy, well, and safe. Again, Dr. Jackowitz from Minit Medical, operating here on Maui, and I hope you all appreciated that State of the Union. As I promised, Dr. J, I just want to go ahead and share with you all that video that he passed along to me, which I thought was really profound, and you may have seen it already, so forgive me if you have, but I'm going to share it with you because I think it has a very profound message. So without further ado, I will cue this up for you. And
tell me the one about the virus girl.
But my boy, you're growing weary, sleepy thoughts about your head.
Please, that one's my favorite. I promise just once more.
Okay, snuggle down, my boy, though I know you know full well that the story starts before then, in a world I once would dwell. It was a world of waste and wonder, poverty and plenty, back before we understood why hindsight's 2020. You see, the people came up with companies to trade across all lands. They swelled and got much bigger than we ever could plan. We'd always had our wants, but now it got so quick. You could have anything you dreamed of in a day, with a click. We noticed families had stopped talking. That's not to say they never spoke, but the meaning must have melted and the work-life balance broke. And the children's eyes grew swollen, and every toddler had a phone. They filtered out the imperfections, but amidst the noise, they felt alone. And every day the skies grew thicker, till we couldn't see the stars. So we flew in planes to find them, while down below, we filled our cars. We drive around all day in circles. We'd forgotten how to run. We swapped the grass for tarmac, shrunk the parks till there were none. We filled the sea with plastic, because our waste was never capped, until each day when you went fishing, you'd pull them out, already wrapped. While we drank and smoked and gambled, our leaders taught us why. It's best to not upset the lobbies or convenient die. But then in 2020, a new virus came our way. The governments reacted and told us all to hide away. While we all were hidden, amidst the fear, all the while, people dusted off their instincts. They remembered how to smile. They started clapping to say thank you, and calling up their mums. And while the car keys gathered dust, they would look forward to their roads. And with the skies less full of voyagers, the earth began to breathe. And the beaches bore new wildlife that scuffled off into the sea. Some people started dancing. Some were singing. Some were baking. We'd grown so used to bad news, we saw good news was in the making. And so when we found the cure and were allowed to go outside, we all preferred the world we found, the one we left behind. Old habits became extinct, and they made way for the new. And every simple act of kindness was now giving its due.
But why did it take a virus to bring the people back together?
Sometimes you've got to get sick, my boy, before you start feeling better. Now lie down and dream of tomorrow and all the things that we can do. And who knows, if you dream hard enough, maybe some of them will come true. We now call it the Great Realization. And yes, since then there have been many. But that's the story of how it started and why hindsight's 2020.
If you look at the camera, they know someone's filming it because they can see it.
Exactly. If you look at the camera, they know someone's filming it.
Stop
Okay,
this
that's the
here
time.
Wait,
so
can I
that we
start this
can
right now?
get back to business. Those cute little kids. All right. Well, I hope you enjoyed this video and the opportunity to connect with Dr. Jackowitz. Please look forward to more videos to come. Every week we'll be posting an interview with a member of the Hawaii Spa Association and other professionals around Hawaii who can give us advice and insight and express themselves in a way that will help us all grow and feel more confident in getting back to business. All right, thanks very much. Much aloha to all of you. Okay, so on that note, thank you all for taking a moment to enjoy our first interview. I want to kick it over to Sharon because, as I alluded, there's lots more to come. Sharon, what can we expect in the weeks that follow?
Well, Sean, thanks so much for that. That was so illuminating and inspiring. And we're just really proud and excited to be able to offer a place to rest for all of us in the community and bringing positive messages and collaboration. So next week we have a live interview with a general manager in the hospitality industry. Brian Hunnings is general manager of the Residence Inn in Kapolei on Oahu. And he will be speaking to us, answering some of the same questions and giving us a few updates as well of kind of what his take on State of the Union is. And then we have a few other professionals, both in the wellness industry, as well as just other perspectives and voices of the community. If there are people that you are interested in hearing from, please let us know also. And thank you so much. We're really excited to bring some live and some recorded pieces to you. From here, Sean, did we want to pinch hit over to Jen?
Yeah, I think we'll turf it over to Jen, our fearless vice president of the Hawaii Spa Association. She will bring things home.
Aloha, everyone, and thank you, Sean, and thank you, Sharon, so much for putting that together. What an insightful interview with Dr. J, and there's some really great takeaways that I have, and I know that everyone here probably has the same. I did see, and I just wanted to say briefly, I saw that Sharon put in the chat box, putting it out there to all of you as professionals, if there's specific topics that you'd like for us to include into the series as we move forward, or if there are particular professionals in the community that you would like to hear from. We would love to hear your comments. We want to make sure that these series are as beneficial as possible for everyone. So we invite you are welcome to put it in the chat box now, or if you think of something after this session, please feel free to email us. The email address has changed slightly, info@hawaiispassociation.com, or you can click over to our website and there is a contact us page where you can put all of that in, and one of us would respond as quickly as possible to you. But we really look forward to a collaborative nature in this series and making sure that we're providing you the most helpful information. And thank you, Sean, for putting the website up. I know you wanted to also show, we have our new resource booklet that we have put together. And I have to say that, you know, the board has been tremendous through this time and just making sure that we're putting together as much information as we can for you. So feel free to go to the website and check out the new resource page and the education page that we have. And Sean, if you want to go through it briefly, I'll kick it back over to you.
Oh, great. Excellent. So this is sort of a work in progress put together by your board, and, you know, not without the assistance of many of you who could be actually reviewing this presentation. So first and foremost, we'd like to thank a number of people. I thank my fellow board members, but also the Hawaii Cosmetology Board, the International Spa Association. We're getting information from the CDC on a constant basis, healthcare associated infections, Food and Drug Administration, and a multitude of other resources. So what we're trying to do for you, and we realize it may not be perfect yet, because this, remember, this is changing every single day. But as of now, this is what we believe to be a great synthesis of what's available in terms of research. So you'll be able to download this, this guide for your review, or just, you know, review it from the website. But we list top priorities here. in the guide, you know, outlining your own critical path, having welcome back meetings, anticipating needs by collaborating with your team. You know, so make sure that you review that page pretty carefully. We did connect with employers in our association and outside on their thoughts on safety and, you know, the things that we already know, things like that are effective, like social distancing and PPE. There's also, I think, more intensive discussions to be had about employee health and wellness and practices and protocols around that. What we're going to do to enhance our cleaning and sanitizing policies. This is, again, a jumping off point for all of you to help us with this conversation. There are some excellent resources that we've included in hyperlink in the guide. So you can click on to a list of practices that was posted by the CDC. They're always a great resource. Again, other useful links embedded in this guide itself. So take a look. We think it's a pretty fabulous tool. And we welcome your thoughts. And if any of you reviewing this presentation would like to be a guest speaker and share your thoughts on how we can enhance our practices as a community here in Hawaii and come together, we'll get you in the second edition of this guide as it comes up, and look forward to hearing from you. But that's the scoop. Anything more you'd like me to cover on that, Jen?
No, that's great. Thanks so much for going through that. And I think at this point, we want to open it up too to see if there's any questions and just have open dialogue if there's anything that is burning questions out there. I know that Sharon and Sean and myself, Cecilia, Daryl, on behalf of the whole board, we just want to be as helpful as we can. And so if there's any questions that we can answer right now, or we'll find the answer if we don't know it right now, but if there's any questions out there, please feel free.
You know, I'd just like to jump in, if I may, and just mention to those who are on the call now, is that one of the challenges that we've had over the past few weeks or months is that because we're not at our work computers and able to be contacted through our work emails, the challenge being able to get through to everybody has been somewhat of a challenge. And so I would encourage everybody who's in touch with any other member of the spa industry in Hawaii and further afield to try and get a personal contact number to us, such that we can maybe enlarge the Zoom group and distribution list that we have. And if that can be forwarded to any of the board members, any personal contacts that you feel comfortable sharing for yourself or anybody in the spa industry would be much appreciated.
Great. And I just want to point out, Daryl and members of the association and anyone else, if you go to our website and you click on About, you'll see everyone's individual email address here. So, for example, if you'd like to reach out to Daryl, he's got his email address right on our website. So take a look at that if you want to do it that way. You can also reach us at info@hawaiispaassociation.com.
I see that we have a question from Joshimi about our thoughts on reopening. And I think we're all watching the information that is coming from the state. And at the same time, I think it's important for everybody to create more of a critical path concept where you actually look at your spa almost like it was a brand new spa. And you have to be extremely flexible, put certain dates, and be able to constantly change it. But I think massage and facials for sure, and body treatments are going to be the last area that is going to be open. You know, I kind of foresee personally that the fitness areas, locker rooms, retail, are going to be the first areas that we can safely feel comfortable and open them. And then be extremely cautious on how we make our employees feel safe and our guests feel safe and regain the trust on our industry.
Yeah, that's a really good point. I wanted to add one thing to that. It's as much as we're all trying to come together as a team and figure out our own critical paths, part of our critical pathway that needs to be considered is guest perception or consumer perception on safety and wellness. You know, they always say, if you build it, they will come. But I think in this point, if we put it together, they may come and they may not, depending on our messages. And so we need to be prepared for that, and how we need to engage people on a new way to help them feel safe, because, you know, we might know that we're dotting all of our I's and crossing all of our T's with these new protocols, but people are in fear. And so we need to work with that as well. So I'd love to hear some discussion around that in the future.
I also, you know, one thought that I have too, in thinking about the future of these sessions, and as Sharon had mentioned, next week we're going to have a general manager here with us. I think it'll be a really interesting point of view, because a lot of us are tied to when people are coming back to the island. When are the hotels going to be able to have our guests come back? And that's going to directly affect us, and what parts, as Cecilia mentioned, what parts we're able to open, if any, in our facilities. So I think next week we'll get a lot more deep dive with kind of the State of the Union with hotels as well.
Yeah, and I think each property is different. Everybody has a different formula. Not all the information that is out there will fit to every facility. There's a few of us that it has a strong membership component, and a lot of the members escape to Hawaii to just hang in here and wait for this chaotic time to pass by. So we have to cater to these members and making sure that they feel safe, and sanitation, of course, is a top priority. But also some unique requests. So if you have any information, or if you need any extra help, we also realize that most of us, for not saying almost all of us, are on furlough, and we don't supposed to be working on any plans or anything, but our brains don't stop working. So HiSpa has been a great way to put information so everybody can share.
Yes, and kind of to that point, so I'm living in Arizona now, although kind of working in both areas, and what we're finding is a lot of the governments are reopening the spaces is the short-term nature of the updates that we get, right? So you'll get a notification on a Monday to be open by Friday as an option. First and foremost, that doesn't mean you have to open, but also importantly, just to understand that that could be the time frame. It's good to be prepared, as Cecilia said, and have your checklist ready so that you have the ability to be nimble and shift to which area, which division is open, fitness, salon, or massage and facials. And then we want Hawaii Spa Association to be a resting place. So having resources that you can come and will help with being nimble by trying to update that as much as possible. And the last point is just to make sure that you have the timeline strategy, but also consider that with COVID, it's also the impact to the people that have the greater contraindications. And so we in the industry are familiar with contraindication questions, and also adapting your strategy to your workers as well as to your clients to say, this is the right time for you to come back if you're healthy and raring to go and excited to come and get a massage, facial, salon, whatever. But also if you have compromised immune system, this would be the additional precautions we recommend for you to come back and for us to be able to service in the best way. So just kind of multiple strategies in reopening.
You know, I think that you make such an interesting point, Sharon, with those that are in higher risk populations coming back to spa, whether that's based on age or health conditions. That is something that we haven't had to consider other than just doing a general intake form. And it's all been about personalizing a treatment to meet those needs. I think in the new normal, we may need to consider times. You know, maybe there are certain times dedicated in the day that are lower traffic, where we're driving our higher risk populations. You know, just like we would do peak pricing and non-peak pricing, we could look at how to engineer the day to cater to specific populations and manage traffic flow. Because what we do know is we're going to be staggering appointments. because we don't want everybody arriving at the same time, whether they're guests or employees. We also know that treatment times will need to be adjusted. You know, gone are the days of the quick 5-minute, like, let's clean your room and flip it for the next person. We need to go deeper. And so we're going to be re-engineering that. So I do think, you know, as Cecilia pointed out, we need critical pathways to reopening that are strategic based on low risk services, you know, whether we start with our, you know, salons, maybe our pedicures, things like that, and then moving on into services that are higher contact. And I would put our aesthetic services at the higher risk portion of the spectrum. You know, so it's not going to be easy, but it is possible, and it's going to require a whole reworking of this system.
Great. So we wanted to make sure to keep this to an hour. If there's any final questions, I forgot to mention next week we'll also be on Thursday at 1 p.m. for the call. So stay tuned for the Zoom invitation that we will post as well. And Cecilia, Jennifer, Daryl, Sean, any final thoughts, words?
I just want to, again, just say our deepest gratitude and thanks for everyone for being here and participating today. And we hope to see all of you back next week and for the future sessions. And we're here in the meantime at those contact information that Sean highlighted if you need anything in the future. But stay well, and hopefully we'll see you again next week. And in conclusion, I'd also just, there's some person who is conspicuous by her absence, but we're looking at her work. There's been a remarkable change in our website, and firstly, getting the website back up online, and certainly the new artistic and graphics look that we're seeing on the website. And that is Sasha Herchik. And on behalf of the board, I'd just like to express our thanks for a lot of work and time and effort that has gone into making it such a new look and really an asset to the Hawaii Spa Association. So a big mahalo to Sasha.
Oh, thank you, Daryl. Appreciate that. And just lastly, I just wanted to tell all the, you know, members and non-members and anybody that is in this call that if you need anything, please feel free to connect with us. If you need a layout for a plan or a critical path or some information, you know, feel free to reach out. We're here to be connected and to help out. Thank you so much.
Next time, let's get some more cameras on our videos so we can see it.
We want to see your offices. We want to see how clean they are.
Okay. Take care, you guys. Thank you.
Take care. Thank you.
Thanks, everyone.
Thank you.
Aloha.
Aloha.
Hi, Kyla. All right. I'm going to stop the recording.